Great. Thank you so much, Angela. And thanks everyone for being here. I'm really excited about this talk today. It's a bit of a newly developed one that I prepared. Angela selected from a few that I had provided, and I'm very glad that this was the selected one, even though it took a little bit of legwork. And I just need to take this moment to acknowledge that the work I'm going to present on today came from a variety of different people, some of which are in the room with you there at UBC today, and a variety of different research organizations and funding organizations have contributed to a lot of what I'll talk about today. I also decided to include a history of women's influence in the labor market, or the labor movements of the 20th century. And for that history section of the talk, I'd also like to acknowledge the Ontario Federation of Labor, who's documented a lot of just has a ton of excellent resources on the history of women in the labor movements of Canada. So just to sort of have some placemaking for us before I start, because I know that these concepts could be, old hat for some of you or brand new for some others. So sex and gender, why do they matter? Just some definitions and some kind of framing so that we can hopefully agree from the outset that having more or less segregated workplaces would be better. So sex refers to biological attributes of people. So that could include things like hormones, respiratory rates, body size, and composition, whereas gender refers to social constructs, and these could include different gender-based roles, behaviors, identities, assumptions. So in terms of sex, sex could affect how chemicals are metabolized or how a worker might perform a physical task based on their own physical abilities. So for example, female workers on average have faster breathing rates and smaller body sizes, and that might actually place them closer to an exposure source and increase their level of exposure. Male workers are also more likely to have greater muscle mass and body weight, but actually less fat, which can affect how they metabolize, store, and clear some chemicals. There's also some occupational diseases that only affect male or female workers based on the presence of whether or not they have an organ, so a uterus or maybe prostate cancer, if we're thinking of a disease. And finally, the differences in the severity of symptoms or disease progression do exist. So women tend to experience more severe work-related asthma symptoms than men, for example, for reasons that are complicated and not very well understood. For some examples on gender, gender is differentially associated with income levels, with precarious employment relationships, with work-life balance and social benefits, and these in turn influence the risk of occupational disease. So the distribution of labor across jobs and tasks also mean that exposure to hazards does vary by gender in ways that could overlap with sex, but sometimes not. As we know, both sex and gender exist on a continuum, and so these things kind of interact in complex ways. This could influence different exposures that people might experience. So women are more likely to report that they have exposure to things like disinfectants, hair dyes, and textile dust. And even within the same job, we know that task segregation can lead to differential exposure. So for example, men are more likely to report exposure to things like welding fumes, pesticides, and wood dusts compared to women, even when they're employed in the same job. So there are these sort of task differences across gender and sex that can influence these exposures. Part of this is really, I think, what we all kind of know and understand. We all live in this world. There's gendered assumptions about ability, and this might lead men or women to be assigned to different tasks, maybe based on their physical strength or perceived physical strength or communication skills, and that can lead to different exposure scenarios. Another important factor is men tend to cluster in high-risk industries, and I'm going to talk a lot about that later on because we're talking about occupational disease and in particular cancer today. So men cluster in jobs that are in construction and mining. This is both increases their risk of exposure to a wide variety of things, but it also can really contribute to a masculine culture that celebrates physical strength, toughness, and this can just place men at higher risk of exposure to hazardous materials in these settings. There's also some differences in PPE availability and how well it works on people of different sizes, and this could include women or indeed smaller men. So having a wide variety of PPE actually is better for everybody. And just to make the case before I move on, I know I'm talking a lot on this slide, but I just want to make sure we're all at some sort of baseline level. So we recently wrote a paper on this gender division of labor led by Emma Quinn. And the way that we kind of framed it in that paper was that if we reduce the sexual division of labor, it has important sort of theoretical and practical benefits. So on the theoretical side, the sexual division of labor, it constrains stereotypical, quote, women's work to lower pay and status. And that's going to come through a lot in the history part when I get to it. And a societal push towards mixed gender jobs in organizations can break down those stereotypes that have disproportionately affected women. And on the practical side, gender balanced workplaces contribute to enhanced job performance. They have better retention rates, so people tend to like working in more gender balanced workplaces. And for the economists in the room, workplace gender equality has strong positive impacts on company level economics as well as at the country level. So because of these really far reaching impacts, trends in the sexual division of labor are important to monitor. So I've split the talk into a few sections. This first part is history. I will caveat this saying I'm in no way a historian, and I really did rely on the work of others to ending of the gender division of labor it really is framed by how we got to this place, and it's focused on women's entry into the workforce over the 20th century. Sorry, my internet is unstable. Hopefully I'm not freezing up too much. But later on, I will speak to how work functions in a complex light. So even just the right to work is tied to rights of self-determination, and work also differentially harms the people who do it at the same time. And the first part will focus on women, but men have worked both in the past and today in more dangerous occupations. And they've also been paid more to do that work, and shutting women out of the lucrative positions to maybe save them from these things. And so there's some complicated discussions to have there. Maybe we can talk about that in the discussion. So I don't think that we can really frame thinking about the gender division of labor unless we think about women's suffrage. So the right to work and the right to vote were really inextricably linked for women in the early 20th century, and they were also linked to big societal forces, mainly different fights on equality for different marginalized groups, but also on real impacts of wars, World War I and World War II, as well as the Great Depression and different kind of social movements that happened over this time. But what I did learn in putting this together is that really women had such a huge impact on the labor movement and the push towards workers' rights that actually have benefited people of all genders. I will say this is a really simplified timeline. There's a lot of different things that happened at different times, and voting rights sometimes were sort of brought in, and which is the case for World War I, and then some provinces tried to revoke it, and women were not having any of that. And so it did become federally, at least for white women, they had full voting equality during World War I. And notably, you'll see on this timeline, Indigenous women were sort of the last women to get the vote. And it's actually just shocking how recent that was. So we're at our first poll question. Angela, if you want to launch that. So what proportion of women do you think did paid work in the year 1950? Okay, it looks like we've gotten fairly far. Is that being shared right now, Angela?
Yes, it is.
Great.
I just ended it. Yep.
Thank you so much. So it looks like most of you thought about 20%. Most of you are correct. So fairly low labor participation in the 1950s. And that's not necessarily that there's been sort of a linear fashion of how this has increased. So this graph shows labor force participation by sex from 1950 to 2020. I'm going to caveat that 2020 with a couple slides in just a minute for reasons you can probably guess. Unfortunately, I couldn't find comparable data from before 1950, but it would have shown some waves of higher proportions of women working. This data here and these dates actually tells a compelling story, though, since the 1950s were one of the worst decades for women's employment. And it was actually quite a bit higher during both world wars and during the 1920s. So overall, it does, I think, paint a good news story for women. But I will now spend a couple of slides taking some of that happiness away, given what's happened to all of us in the last couple of years. So a little interlude in this history back into modern times. COVID has really messed a lot of these gains up for women. Keeping in mind that the data I'm showing here was from basically just the first year of the pandemic. So this is as of January 2021. So there have been some gains back that some women and men have made. But 500,000 women in Canada lost their job during the first year of the pandemic. And more than 200,000 of them joined the ranks of the long-term unemployed, which was a threefold increase over 2019. Some of them did come back after the first and second waves of COVID, but the bottom graph shows that the job losses were 10 times higher among women than they were among men. And part of that is because men's jobs did kind of recover as we got through the first couple of waves, whereas women tend to work in these sectors. You'll see that on the bottom there. Women are working in the hardest hit sectors, and so they experience more job losses. And yeah, these are the industries they're working in tend to be hospitality and retail, which were really, for good reason, affected by virus containment measures. Importantly, wealthier women did fine, often even better, but those making less than $800 or $500 a week were the hardest hit, and they absorbed 65% of those job losses. And we also know that mothers faced higher job losses than women without children. And again, this also concentrated in women who are earning less money. And all of this was worse for young women, for mothers, and for immigrants, which is a fairly common theme that we'll carry throughout this history of the 20th century, except for maybe young women, because in the past, older women were more discriminated against. But let's jump back into the history. So let's start in the year 1900. So I'm drawing, this is where I start to draw heavily on the work of the Ontario Federation of Labor, and I've linked to the report that they produced, which was really excellent. I recommend it. It's a great read. So the quote here, the females are better than two men in many cases and not half the expense. This is drawn from historical documents from 1900 to 1901 and was really about the employment of female workers on fishing schooners that traveled seasonally from Newfoundland to Labrador. And there was, interestingly, an inquiry about the truly terrible working conditions and accommodations on these boats, which nobody actually asked the women who were doing that work what they thought. The more the solution was proposed to just ban women from doing this work in order to protect them, though the big fight at the time was that this would amount to the fishery paying a man to do a girl's work, because a lot of the work that happened on these fishing vessels was done by women, and especially young women. Some of the other questions asked during this inquiry were, what effect does the voyage have on the moral character of the females employed, and are the unmarried exposed to peculiar temptations resulting in cases of sexual immoralities? Or would the prohibition of female labor in these vessels have an injurious effect not on the women, but on the interests of the Labrador fisheries? A lot of care was also asked surrounding on who's responsible for these women, and this is just basically because women weren't legally persons at this point in time. So that really kind of puts into context how women were experiencing work at the time. Women were absolutely always working, but sort of didn't have any autonomy over the wages that they earned. In this period as well, most of the jobs available to women were in domestic service. So close to 50% of the female workforce were domestic servants, which was grueling, low status work with poor living conditions. Also in this time, I found a little bit surprisingly, given how oppressed women were, they did actually start to organize. And so 400 Bell telephone operators walked out in protest over the employer's efforts to increase their daily hours of work and cut their wages. Those operators, who were all women, worked in really incredibly stressful situations, responsible for 100 phone lines, handling 300 calls an hour, often in precarious ergonomic positions, trying to plug different plugs in to connect people's phone calls. And the long distance lines notably frequently gave operators convulsion-inducing electric shocks. So really terrible work. As a result of that strike, the labor councils across the country began campaigning for payment for workers injured on the job. And by 1920, most provinces had the scheme for what was at the time called workmen's compensation, which is now workers' compensation. So those new laws did refer only to workmen. It was the young women strikers of 1907 that started one of the most important advances in Canadian labor history. So there were, I have to stop and say that a lot of these, the narratives are really about white women. And so we have to also consider intersectional approaches, and that racism was very much alive and well. So for example, it was illegal in Saskatchewan in the early 20th century for Asian business owners to hire white women or girls. So this had a directly negative impact on women who were denied those jobs, but also because the population of Saskatchewan at the time was more than 90% white, it severely limited Asian business owners' ability to operate their businesses, which were often shops and restaurants, which would typically be jobs that women would do. So they couldn't hire white women to do those. So it really impacted their ability to run their businesses. It's not a coincidence that most provinces extended voting rights to white women, at least during the period of the First World War. They needed women to work since men were overseas at war and disproportionately dying from the pandemic of 1918. So women were seen as productive, cheap, and disposable labor in these periods. And I've pulled some images that I found sort of showing what that work looked like during the wars. However, during the World War I, this is when most provinces did extend the right to vote to white women. Here are a few quotes from the Toronto Daily Star in 1917. I won't read it, just to say it is good news that women were working, but it's not like work was really great for them at the time. So there's some quotes here pulled from women who were working in factories and in munitions at the time. So paid work is really important for autonomy and for self-determination. But yeah, people weren't having a lot of fun doing this work. The working conditions of the time for everyone, men and women, were extremely poor. There were few limits on the length of work day or work week, and very little understanding of how exposures to various chemicals, oils, metals, and dust might negatively impact health of both men and women working in those situations. So the panel on the right here, I'll just leave that for you to read, was a message from the government of Ontario to working women in the 1920s. So following World War I, a lot of women were working during World War I and they held important positions, but after it ended, they were marginalized into what's called the pink ghetto. So jobs that were disproportionately female, very underpaid, just because men were coming back and they were sort of getting these better paying jobs back. Women did at the time work in the civil service, but during the 1920s, they were shunted to the lowest ranks of the civil service. Job openings were actually classified by sex. So the same job would be like, here's the men's version, here's the women's version, and the women's version would pay half as much and have no opportunity for advancement. At this point, too, married women were prohibited from holding permanent posts in the civil service. So that's what I was talking about before, how age impacted discrimination against women in this time. Even given this setting and given this bias against women working, especially married women, women did excel for a while, and many more would have, but for deliberate and calculated efforts to bar their way. So the 15% of women in all job categories who were in the paid labor force in 1921 found themselves in this reality where they couldn't, they were making very little money and there was no way for them to advance. So, and the pressures there were really to just make them go back home and not work. After the relative prosperity of the 1920s, the Great Depression caused actually a very distinct split in the roles of women at work along those lines of marriage. So single women, especially those that had begun to work in the labor movement, so they were becoming very active in unions and getting more educated, they actually more frequently chose to just stay single so that they could keep working and supporting themselves. And many of them never married in order to continue to sort of having that self-determination. And married women experienced such extreme social stigma, both socially and legislatively. So many jurisdictions banned married women altogether, or they allocated less in unemployment benefits to women than men. And they sometimes would even ban women from collecting those benefits if they would refuse another job, and that job would always be domestic service. Things sort of go up and down, you'll see across the 20th century. So World War II marks a really large shift in the roles of working women. So there were really severe labor shortages and a need for goods and munitions, much like in World War I, but women had a lot more power at this point, and they really they took a lot of power and made a lot of social change during this period. So women's participation in the labor force doubled during this time. And for the first time, that surge actually included Black women and Indigenous women. So one really interesting fact here is that women couldn't work without childcare, obviously. So in 1942, provinces actually started to support wartime daycares, and a brand new field of early childhood education grew because we started actually having province and federal funded childcare, which we are still very much fighting for today. When the government actually tried to withdraw that funding at the end of World War II, women were very angry and had a lot of marches and protests and demonstrations. And as a result, in 1946, at least in Ontario, as an example, they became the first province to fund regulated childcare. Women's work in World War II led to a wave of women organizing afterwards. So these are just some images of women working in World War II. So as a result, during the first half of the 40s, many thousands of unionized women did win their demand to receive equal pay. for equal work, at least on paper. And these victories improved the statistical earnings of women so that by the end of World War II, women were earning about 60 cents on the dollar, which was up 3 or 4% from the pre-war average. So still not great, but improvements were happening. And by 1951, the Ontario government passed the Fair Remuneration for Female Employees Act, which took the first steps forward in legislating for equal pay. And also interestingly, during this decade, women's participation in the workforce reached a high of 34% in 1944. And then, as you know from the poll before, it began to fall. And not until 1967 did we see this peak reached again. So the 1950s was another lurching backlash to women's work, and it was an especially dark period for Indigenous and other racialized girls and women, both in the workforce and in general life. Many women did really resist the attempt to separate them from their work. Many of them needed to work, especially racialized women, and many more just wanted to work. So there was, even though sort of our pictures of what we saw in television at the time, which is largely white families, stay-at-home mom, breadwinning man, there actually were still a lot of women who had to work and were working, but they were still kind of relegated to female-only jobs, these pink ghetto kind of jobs. And at the time, they often needed more education than men to gain access to even lower-paying jobs than men were allowed to. And a premium started to be placed on youth and beauty, sometimes explicitly so, as in this example from American Airlines, where women when they were in workforces, were starting to be quite sexualized in that work. However, even under the surface of all of this sort of almost propaganda, I would say, in terms of showing all these white, picket fence families, under the surface, about a third of women who had worked during the war kept their jobs. And some of them, maybe they would take some time off when their children were little, but they would go back after their children were older. So the next phase of things happening for women, a lot of things really started to happen in the late 60s to the early 70s because of women's liberation, also known as second wave feminism. And there was a lot of civil unrest happening at this time, protests about wars, rights of Black people, as well as lesbian and gay people, and Indigenous rights. And during this time, a huge change started to happen. And you can see that uptick in that slide I showed before of women's labor force participation. It increased by 79% over this time. And the number of women in unions increased by 144%. There was still prejudice, there were still problems. We know there still are today, but this was a huge shift. This was also overlaid with abortion rights and contraception rights in Canada, which really allowed women to gain control of their own bodies and fertility, so that working was just more practical for them to actually do. This is the sort of last slide I think I have on talking about the historical things and moving into modern times, but there were a lot of really fun ads that started to happen in the 1970s that really were trying to capitalize on women's liberation and use it to sell things, which is kind of interesting. So this center ad, I'll just say, is from Bell and AT&T. It's an interesting one because the small print you can't read about this phone installer, Alana McFarlane, which we can talk about her safety processes here in this image. But they actually had a policy at the time at Bell and AT&T that they wouldn't allow any job to be entirely men or women. So they were forcing people to have more gender integrated workspaces, and that they specifically said it's because they wanted people to do what they do best rather than just fill a gender role. So there's a quote from Alana in here that said, "I don't go for office routine, but as an installer, I get plenty of variety and a chance to move around, and I get a kick out of working 20 feet up in the air." So really a big shift of how women's roles were constrained even just 15 years before this. I also included this ad from Virginia Slims because it has this very famous women's rights slogan at the time, which was "You've come a long way, baby," which is funny, but perhaps not as funny as a cigarette branded toolkit and a joke about wearing makeup, also whatever this outfit is for fixing things around the house. Into the 80s and 90s, women continued to make gains in their rights at work, and this started to extend further to include more than just white women, and increased recognition of women's inequality. And some major victories during this time included more anti-discrimination policies based on sex and also sexual orientation. I will say it wasn't all sunshine and roses, and mostly the negative times were led by various governments who cut access to the public sector, or cut jobs in the public sector, which then and now are disproportionately held by women. And so they lost more when the public sector jobs were cut. And many of you in the room will remember some of these governments and how they had a huge impact on women's work. So this is where I'll shift, and I've sort of talked about what, the difficulties women experience over the 20th century. Now that you know a bit more about that, let's talk about men's work. So much of the exclusion of women from well-paying and skilled positions was just flat out sexism, but sometimes it was phrased as saving them from risky work. And this is absolutely true. It's patronizing, but it was true then and true now that men are overrepresented in experiencing injury, in exposure to hazards, carcinogens in particular. So I'll talk about that today, and subsequently occupational disease. So gender is impacting both men and women and people, and gender nonconforming people as well, in different ways. So this wheel from CCOHS highlights how gender could differentially influence occupational health by sex and gender. So for example, women shift workers with children are more likely to get injured. Physical and psychosocial differences influence injury and illness rates, even when men and women are working in an identical job. So it kind of speaks to a little bit about how we do exposure assessment. And I think the lack of consideration of sex and gender and occupational disease over time has masked situations where either men or women were at higher risk of exposure and negative health outcomes. So sort of summarizing this part of the talk, sex and gender-based evidence of occupational disease is vital to population health prevention strategies in the labor force. And we have our next poll question, where we move more into present day. So thinking about carcinogen exposure in particular, because that's kind of what I do mostly. What do you think the proportion of male workers exposed is the most frequent category? So we have a whole bunch of carcinogens and we know how many people are exposed to them. How gender segregated do you think they are? So 50% male workers would mean it was 50% male, 50% female. So these are the different categories we have. Great, looks like people are participating. Okay, and looks like the results are being shared. You guys are going to be shocked in a bad way. So it is, I'll show you in a second, but I run a research project called CareX Canada, which some of you might have heard of, where we estimate the number of people exposed to about 45 different occupational carcinogens. And we also provide our estimates by sex. And so for the carcinogens in our CareX Canada database, with at least 10,000 workers exposed, which is shown on this slide, you can see the prevalence of exposures in the darker bars, just in terms of number of people doing those jobs. I haven't put what carcinogens these are here. You'll see those in a moment, but I'll dive in more closely in a second to that. But this is just to demonstrate that a lot of these jobs here are coming up above 50% men exposure, and some of them are really clustering up here. And if I actually break this down in the next slide, you'll see the answer to that. The unfortunate answer to that poll is 90%, is the biggest category here. So for the 45 carcinogens, we were able to estimate exposure prevalences by sex. It's got the sort of percent on the y-axis by some of these categories of proportion of male exposed. So a full 1/3 of those carcinogens that we estimate exposure for have more than 90% exposed, and only 4 of the carcinogens in our database had a majority of female workers exposed. So let's dive into that a little bit more and talk about how these different types of carcinogens cluster by sex. Just going to take a look at my time. Okay, good. So this slide shows the top 10 carcinogens in the CareX Canada database by sex. So it shows you the prevalence of exposure in female workers on the left and male workers on the right. So you can see the ones that I've highlighted there are ones that are common to the two lists. So half of them are sort of in the top 10 for both male workers and female workers. However, you're going to see, though, that for most things on the list, there's just far more male workers exposed just in sheer numbers. So, and also all these percentages are quite high. So you can see there is some variability. For some, there's just really large exposure groups. So diesel engine exhaust is a really, really big exposure. So it'll come up in our top 10 for women, but actually only 9% of those exposed to diesel are women. And really big ones that tend to come through for women are night shift work. And that you can start to think about what kinds of industries might be influencing those gender and sex breakdowns across those jobs and industries. So because a lot of women work in healthcare, which is an industry that's dominated by shift work, we start to see that. So let's talk a little bit more about how we're doing now. And here I'm going to talk about this paper that that Emma led and with others in the room, where we actually were really interested to examine how segregated by sex we still are in Canada and whether or not that's getting better over time. So in this study, we used census data for 1991 to 2016 to look for recent trends. And we defined segregated jobs. There's not really a standard definition, so we defined it as more 75% or more in that job or industry were either male or female. So you can look at that by most detailed job category in this table, which is 1 digit, or down to the most detailed by, which is a 4-digit. So the left side of this table has the number that were segregated in at least one of the censuses from 1991. And on the right, it shows the number in which the job was segregated in all of those censuses. So the census happens every 5 years. You can see that there's a large chunk of job titles that are highly segregated no matter how you look at it. So these are more than 75% of people in each job are of one sex. So what are the most highly divided occupations? You can see here the segregated jobs for men are on the top, and probably none of those surprise you. A lot of I have some images that you'll see popping up, and all of them are available on free websites, but they are basically what showed up when I typed in men's work or women's work. So it's kind of really baked into what we understand about work and in terms of whether female or male people do those jobs. And you can see that is really reflected in these job titles that I almost don't need to label that which jobs are the men's jobs and which jobs are the women's jobs. And you can see here again that all of those jobs are well over 90% comprised of one sex. So female jobs also are very sex segregated as well. For poll question 3, I think it's our last poll question. So I showed you sort of how things are kind of relatively recently, but in terms of changes, do you think we're getting closer to 50-50, or do you think they've improved over time, worsened over time, maybe stayed about the same, or maybe it depends? Keeping an eye. That's great. So it looks like more than 70% of you have answered, and a lot of you said it depends. I'm glad you did. That's usually the right answer in science, and it does depend in this. So let's take a look at some of the more trend analysis there. So this shows you changes over time in the proportion of workers by sex and occupational group. So apologies for the small numbers, but basically the y-axes are the percent of males and females working in these areas, and time or census year is on the y-axis. Women are in the red lines and men are in the blue lines. So basically this image, and it's split into two. So this is some of the industries. I'll show you the rest in a minute, but it shows you two things. So how far apart are those lines from one another? That shows you how segregated that workplace is. And it tells you the division of labor. And secondly, if you see the lines coming together from left to right, that's a good thing. If they're coming closer to 50-50, we're getting closer to gender parity. If you see they're not changing much, like for example, in trades and transport, it's highly segregated in favor of men and hasn't really changed a lot since 1991. Or you can see that the sciences are getting better over time. Though somewhat stagnated in 2001, and management getting closer to gender parity and women making some serious gains there, which is great. Some things are getting more divided though, in terms of, we started in 1991 with a pretty sex and gender balanced art, culture, and sport industry, and it's getting more female over time. And just for the last few here, this is for the remaining 4 job types. You can see education and health both being heavily dominated by women and probably getting a little bit worse over time. So overall for this study, we found that the labor force is highly divided by sex in Canada, with 40 to 60% of occupational categories being either mostly men or mostly women. And the distribution of labor was consistent for 40 to 50% of those categories across all of those years. So there wasn't any sort of one really excellent year or one really bad year. They were all kind of consistently similar. Women represent a higher proportion of workers in education, healthcare, and administration, while men are working more in repairs, construction, and transportation. So next steps, path forward. I'd like to end on some more what we can do about it, and what are some good news stories. So I'm just going to talk about one upcoming study that we recently had funded with some folks at UBC, including Mika and Chris and others across Canada, where we're trying to see what we can do about this. How can we describe the gender division of labor and maybe improve it for men and women? So we were funded this year by CHR in a project grant to improve occupational exposure assessment by sex in Canada. And the project includes creating some new sex-specific job exposure matrices. This is specifically to get that idea I talked about earlier, where we know that for a lot of jobs, even in the same job title, men and women are doing different things and could have different exposure profiles. And we tend to use job exposure matrices a lot, which don't sort of take into account any variability that happens within those job categories. So it would really be masking any of those differences we see by men and women. And we want to use those new matrices to investigate risks in occupational disease outcomes. So I'll give you some visuals in a second on what the occupational disease surveillance system actually is, but it's basically a cohort of workers where we have detailed job information linked to health outcome data. Right now, there's a functioning ODSS in Ontario, and myself and also others from SPPH and beyond are developing one for the province of Manitoba as well. That's involved in this project too. So we performed a preliminary analysis on the Ontario ODSS to demonstrate the tool's ability to just identify the role of sex and gender in lung cancer risk among workers, and that's shown in this table here. So you can see that women employed in printing occupations had a 40% increased risk of lung cancer, but men did not, compared to all other women or men in the cohort. And similarly, increases in risk were found among women, but not among men working in fabricating, assembling, and repairing electronic equipment. So there might be some different susceptibilities, pardon me, by sex or by gender, or maybe by both. We can also, in the ODSS-based analyses, we can create our own job exposure matrices by sex, which we are planning to do. We have done in this preliminary estimate here. We can look at these differences by job title, but also we might be interested in particular exposures. So we've created job exposure matrices using my CAREX Canada project and team, and applied it to the ODSS already to demonstrate. We can see where we know that people are exposed to silica, we're seeing higher hazard ratios of silicosis. So this demonstrates that it's working. It's sort of a proof of concept to say, if we apply these job exposure matrices, we will be able to see expected trends that we expect to see. So how's this project going to work? So it's a 3-year project. It has 3 phases. So the first one is to review the literature for sex and gender differences and see how we might actually be able to quantify those, and where prevalence of exposure or probability of exposure or level might differ by sex. Then we'll use that information to create sex-specific job exposure matrices, both using CAREX for the carcinogens, and then also some GEMs that are about asthma and dermatitis, because those are also really important occupational diseases. And then we will take those GEMs and use them in the Ontario ODSS, because like I said, that one exists already. And then we'll do it in Manitoba in the final year, because our system will be available by that time for Manitoba. I might just skip this one. It's just basically showing you what the ODSS is, but I want to make sure that we have lots of time for questions. So basically, it's just a cohort that takes people who had a WSIB claim in Ontario, because then we have really good detailed occupation information on them. And then we can link that to health data, whether that's the cancer registry data, physician billing data, to start to look at whether or not some of these exposures people experience at work could be linked to their negative health outcomes. Yeah, there's a complicated linkage that happens there, but I'll just skip past it and show you some of the results from the ODSS that we will be working to improve with estimates by sex going forward. So these figures here, which are available at ocddiseastats.ca, they show the percent increases in the incidence rate or risk of a disease diagnosis among workers in a particular group compared to all other workers in the whole cohort. You can see that the diseases in orange are cancers, and the ones in gray are other diseases. You can look here by differences across different types of job. You'll see here, for example, insulators at a really much higher risk of mesothelioma from exposure to asbestos, which is we would expect for that job title. And some maybe interesting new findings or interesting findings for other different job groups. So the ODSS is really a surveillance tool that allows us to identify workers who are at maybe particularly high risk of disease so that we can try and do prevention activities with them. So I'm showing here construction because it, as you've known by hearing me today, it's a highly male industry, 96% male, in fact, in the ODSS. So let's look at for healthcare, which is a highly female workforce, and you can start to see some different results coming out here. Same thing here, the percent increases, the figures show the percent increases in the incidence rate of a disease diagnosis among workers in a particular occupational group compared to all other workers in the ODSS. So some interesting findings there. These are not actually linked to directly to a known exposure. So we're just looking at these by job title, but still identify some interesting trends and that really show us the next directions for occupational disease prevention in Canada. So outcomes of that project, we are really excited about it. It's going to leverage existing, unique, and rich data sets that we already have in Canada. And it'll allow us to look at population level estimates of occupational exposure by sex and gender. This can be used to target exposure reduction activities and generate new research questions. And estimates of exposure and occupational disease risks are essential, really, for identifying high-risk groups, whether those are male workers or female workers or gender nonconforming workers, to target cancer and other occupational disease prevention efforts. And I think we're also in this group of us trying to, hopefully going to create a strong research network for this type of research in Canada where we're interested in sex, gender, and work and health. So in summary, I'll just say, I'll remind you again that all the photos I've shown you that weren't the historical ones were just for searching for women's work or men's work. So you can see here the women's work ones. These are typical examples of what you'll find if you search in those databases, which I think is really fascinating. But just to say that sex and gender matter in the context of work and health. Women experienced really dramatic shifts across the 20th century with respect to paid work. And this had both positive and negative consequences for them and their health. While changes have occurred over time, the workforce remains highly segregated by sex and gender. And hopefully I've convinced you that considering sex and gender in research design is an imperative for us going forward. And I'll just leave my last acknowledgement slide up from beginning. I really want to thank Mika and Peter Smith, Emma for the work that I included in the middle there, as well as Andy Harper from AHS, who did a lot of the analysis for that trend, and all the rest of the people in our sort of sex and gender work and health team. So I'll stop there.